So we're ready. We're ready, yeah. We live? Oh, okay.
Okay, so good morning, everyone. Today's Wednesday, March 19th, and we've convened the Board of Health for the New York City Department of Health and Mental Hygiene. The time is 10:15 a.m., and I'll now call this meeting to order. I'll conduct a roll call. Are the following members present? Dr. Maida Galvez. Here. Dr. Mitchell Katz.
Yes.
Dr. Simona Kwan.
Here.
Dr. Michael Lindsay.
Yes.
And Gail Nyworth.
Yes.
Great, thank you for being here. Let's move into the approval of the minutes from December the 10th, 2024 meeting. Are there any corrections to the minutes?
No.
Okay, hearing no corrections. I have a motion to approve the minutes. Yes, motion to approve. Thank you.
Second.
Thank you. And a vote from each member. Dr. Galvez? Approve. Dr. Katz?
Yes, approve.
And Dr. Kwan?
Approved.
Great. So the minutes from the December 10th meeting are approved. The first item on our agenda is the proposed notice of adoption to amend. Oh, of course. Before we move into the first agenda item, we wanted to spend a moment just updating the board and the public about some of our high priority activities in the New York City Health Department. So I'll start with a brief update on Healthy NYC. We can move to the next slide. These seem to not be the right slides.
That's weird.
Yep. Wrong ones. I'm looking for the
There we go.
chronic disease slide. Interesting. These look like the ones from December. Sure.
No, that's wrong. Okay.
Break, maybe? Yeah, one, take a break.
Okay, so we'll take a break for a moment and we'll be right back. I'm looking for these.
Yes, that's,
Joseph, should I just,
Yeah, me too. I'm on the machine.
Okay. All right, so we're back from our break and we will continue with commissioners' updates on the next slide. We'll talk briefly about our chronic disease prevention plan and wanted to share just a few updates on the plan. At the end of January, we released our chronic disease strategy for New York City entitled Unacceptable Inequities. So today I wanted to speak a little bit about that report, the impact of the report, and the work that we're doing in that realm. So as the slides are coming up, there are two goals related to chronic disease in our Healthy NYC campaign, which I gave an update about at our last board meeting. The first is reducing deaths due to heart and diabetes related disease by 5% by 2030. And then the second is to reduce deaths due to screenable cancers by 20% by 2030. So these two goals, of course, are within our Healthy NYC campaign, specifically related to chronic disease. And the goals, of course, require concerted action. That was the main goal of our chronic disease task force, was to really bring all of city government together to say in a unified voice across 22 sister agencies, what can city government do to prevent and manage chronic disease in the city and achieve these two Healthy NYC goals. So on the next slide, our task force vision is that city agencies mobilize and collaborate to address chronic disease through upstream approaches using the goals of Healthy NYC at the center. This task force was convened by former Deputy Mayor Ann Williams Isom, Deputy Mayor Anna Almanzar, then Commissioner Vossen, myself, and then Kate McKenzie from the MOFP. And on the next slide, just a brief summary of the work that we did over about 18 months leading up to the release of the plan. We had a series of meetings that really described, number one, what agencies were already doing. And then second, to really start to bring some new ideas towards, achieving our Healthy NYC goals. We then had several meetings around refining the proposals from sister agencies and reviewing proposals. So there were a total of 3 working group meetings. We had dozens and dozens of proposals, and we're able to narrow it down to 19 proposals that were released in the report at the end of January. So on the next slide, just a brief overview of the types of proposals that were put together and put forward by the 22 sister agencies involved. The first category is about meeting material needs. This is an acknowledgement of the profound impact that social determinants of health have on chronic disease and on all health. And so we focused on things like financial support and benefits, food resources, social supports, et cetera, in the meeting material needs category, again, to move upstream and to reshape the ecosystem around creating health and preventing chronic disease. The second is addressing commercial determinants of health. These are the practices by corporations that either facilitate or inhibit health. This includes proposals around tobacco policy, proposals around alcohol and media around alcohol, practices of certain healthcare institutions, et cetera. And then the final area is creating opportunities for healthy living. These are things like, how can we make our environment sure that it's easy to do the healthy thing, whether that's eating well or activity, physical activity, et cetera, or other things, again, in the ecosystem to create health. So the report on the next slide was released on January 28th. We were lucky to have some great news coverage from the New York Times, WNYC, Stat News, et cetera, on the proposal, and have had lots of interest from partners across the city since the release of the report, which is very exciting. On the next slide, we really do in the report describe the context, like how did we get here when it comes to chronic disease. As I mentioned, the 3 main areas of proposals in the report, a summary of existing initiatives, a summary of the new proposals, and then milestones for those proposals. So on the next slide, part of, I think, what is particularly important about this report is describing specifically what are the upstream factors that are creating poor health or great health. What you see on the right is a map of redlining in New York City, and then the catchment areas for our neighborhood health action centers. And these are also, unfortunately, the areas that have the worst and highest rates of premature mortality across the city. And then how do we understand that? How do we contextualize that? So what you see on the left is a adaptation of the Bay Area Regional Health Inequities Consortium. We adapted their framework to really describe all the different levels, whether it's living conditions, social institutions, and other drivers of inequities, including things like poverty, how all of these things create an ecosystem, again, that facilitates health or doesn't. And then we have different call-out boxes on very important issues like food security and chronic disease relationships throughout the report. So with that said, I do want to, on the next slide, just highlight that 14 of the 19 proposals are multi-agency proposals. They overall really underscore New York City as a leader and standard setter in public health and in chronic disease specifically. We emphasize quite heavily our health equity infrastructure and ways in which our place and race initiatives really help us to move forward around chronic disease. We hope that this will be a report that many other cities can use as well, since most major cities across the country have these same chronic disease challenges that we have in New York City. And I should mention that over 40% of premature deaths in the city are due to chronic disease. And it's the #1 killer of people across New York City now that COVID is a bit lower on the list. So again, the idea here is let's focus on really what is driving our challenges and longevity in the city right now. So with that said, I think the next slide, I'm just going to skip through since we're running a little bit behind, but encourage everyone to read the report and look at our call to action at the end. So these are the material needs proposals. The next are the commercial determinants proposals on the next slide. And then finally, the proposals to promote healthy living on the next slide. So I'm not going to read through those, but again, encourage you all to check out the report. And then just in our next steps on the next slide for chronic disease, we are doing lots of engagement. In fact, we just had about 200 stakeholders come together virtually last week to talk about the updates on the report, the reception since it's been released. And we've already gotten a number of emails and outreach from partners and stakeholders telling us the ways in which they would like to help move the proposals forward, which is very exciting. We're doing our own work, of course, across city government to identify and mobilize resources for the unfunded parts of these proposals. We're going to keep pushing through Healthy NYC to uplift this report. And then, of course, we have lots of advocacy work that we're still doing as well around state and federal policy. So all of this work continues. And I just wanted to, again, update the board and the public about this chronic disease report. So thank you. You can move to the next slide and I'll take questions. Yes.
Yeah, so the 14 of the 19 proposals are multi-agency. That's really exciting. Are schools involved?
That's a phenomenal question. Yes, we had several representatives from New York City Public Schools.
Great.
They've been looking at how to update some of the food standards and some of the other policies within schools. So a couple of the proposals are related to that. We also had a lot of active involvement from our sister partners at Health and Hospitals, New York City Parks, and DSS. Those were some of the most actively involved agencies. So yes, I'm glad you called out the New York City Public Schools.
Yeah, so there's an education component as well, right?
Correct.
Good.
That's exactly right. Thank you for that question.
Yep.
Okay, great.
Fantastic.
Wonderful. On the next slide, we just wanted to thank Dr. Rosa
Such a cute
Gill.
picture.
Dr. Gill has been serving on the Board of Health for several years. She joined in 2015 and served for almost a decade. And she supported a number of different important actions taken by the Board of Health, including most recently supporting vaccine mandates to attack COVID, as well as our Board of Health's historic declaration of racism as a public health crisis. She has been an incredible public servant over her many years of service, including being a health policy advisor to the mayor and a former chairperson to the New York City Health and Hospitals Board. In addition, she held positions as executive director of Woodhull Medical Center and Metropolitan Hospital. She was SVP of Generation and Northern Manhattan Health Network, and many, many other positions, including executive deputy commissioner of Families and Children's Services at the New York City HRA. She's also the former dean for health sciences at CUNY. So we are so appreciative of Dr. Gill's service. She is rotating off of the board at this time, but has served for many years, and we're so appreciative of all of her contributions. So thank you, Dr. Gill. Okay, so now we can jump into the rest of the agenda for our board meeting today. The first item on our agenda is the proposed notice of adoption to amend Article 6, reportable diseases and conditions, and Article 13, laboratories of the New York City Health Code. Our presenter is Dr. Shama Ahuja, Assistant Commissioner of the Division of Disease Control, and I'll pass it over to you, Shama.
Hi, so I am actually the Assistant Commissioner for the Bureau of Communicable Diseases, but I'm representing the Division of Disease Control today. Thanks so much for having me. And I am here to discuss disease reporting changes that we've proposed to Article 11 and 13 of the Health Code. So, by way of reminder, we're here today to discuss a notice of adoption for the following proposed health code changes for Articles 11 and 13. We propose adding one reporting requirement, taking away another, and modifying 6 other requirements, largely to align with the New York State Health Code. Next slide, please. So just to review where we are in relation to the rulemaking process. So the Board of Health approved publication of proposed rules on December 10th, 2024. There was a public hearing held on January 23rd. No comments were offered and no written comments were received either. Next slide. So I'm just going to quickly recap the proposed changes. And in terms of Chronobacter reporting, we are asking to amend Health Code to require healthcare providers and labs to report cases of Chronobacter infection among infants under 1 year of age to the health department. This is mostly to align with the health code with national reporting recommendations that currently exist. And it'll help us improve our understanding of the burden of this infection among infants in New York City to enhance cluster and outbreak detection, control, and response work. For COVID-19 reporting, we are aligning with the New York State reporting requirements and asking to remove the requirement to report COVID-19 cases within immediately and moving that to reporting within 24 hours. And this will just reduce overly burdensome reporting requirements that currently exist. In terms of respiratory syncytial virus or RSV, we're asking for reporting of pediatric deaths to align with New York State reporting and also to align with how we also ask for pediatric deaths for our flu cases. And so this is just sort of aligning our requirements for respiratory disease of concern for the pediatric population. We're asking to remove trachoma reporting. We have not seen any cases of trachoma for several decades, and this has also led to erroneous reporting related to STI and chlamydia. When we do get reports of trachoma, they are often chlamydia. So just to take it off the list, given that we haven't seen any cases for so long. Next, we've proposed making our surveillance for Candida auris more robust by adding it to the health code and including reporting of antifungal susceptibility results. This will allow us to better monitor drug resistance, investigate reported cases, and implement and evaluate infection prevention and control measures for this fungal disease. For varicella reporting, we're looking to align with New York State reporting requirements. New York City already requires labs to report varicella, but now we propose asking providers to report as well. And then tuberculosis. So here we're looking to narrow the scope of biopsy, pathology, and autopsy findings to be more specific for active TB disease so that we can take off some of the burden on health department staff as well as on providers who are currently required to report a broader scope of findings for pathology reports. And then finally, we proposed a nomenclature change from monkeypox to mpox so that we align with the World Health Organization, CDC, and New York State in terms of terminology for this condition. So next slide, please. This is just a summary of the changes that I just outlined, and then happy to take any questions you might have.
Thank you so much, Shama, for the presentation. At this time, we'll take questions from board members if there are any questions.
Thank you.
Sure. Thank you so much. Great. So Could I have a motion to, since there are no questions, could I have a motion to adopt the proposed amendments to Articles 11 and 13 of the New York City Health Code?
Motion to.
Thank you. Let the record reflect Dr. Kwan motion and that Dr. Lindsay seconded. I'll now take a vote from each member. Dr. Galvez? Approve. Dr. Katz?
Approve.
And Gail Nyoweth?
Approve.
Great. With unanimous vote in favor of the motion carries. Thank you for your votes, board members. Next on the agenda is the proposed resolution to amend Article 141, Water Supply Safety Standards of the New York City Health Code. Our presenter is Diane Fung, Assistant Commissioner in the Bureau of Environmental Services and Engineering. I'll pass it to you.
Thank you. Good morning, Board of Health. I'm here to propose two notices of intention that would result in some the health code. The first is for Article 141, which is our water supply safety standards. Specifically, we are proposing amendments to section 141.11 of that article, which applies to adding chemicals or other substances to water that is intended for human consumption. Our high-quality drinking water flows from upstate reservoirs through the water tunnels and an underground distribution system, and then gets to each individual building. At the building owners may elect sometimes to supplement that water. Our department requires a permit for entities that perform that work. Examples of the work that is allowed include disinfecting the plumbing system to treat pathogens such as Legionella, or to add chemicals to prevent corrosion or scaling. Slide. Our proposal modifies record-keeping requirements for permittees operating these systems. There are currently 16 permit holders in New York City, and they operate at about 350 buildings. For installations, the reporting timeframe is extended from 24 hours to 5 business days upon request. Reporting the start or end of treatment remains within 24 hours. Permittees are also being asked to report specific information in the manner we specify. Our department currently provides forms so that they can do this to meet the requirement. Next slide. We are asking the board to vote for approval for publication in the city record, proposed amendments to Health Code Section 141.11.
Thank you so much, Mrs. Fung. Are there any questions from the board on this proposed amendment?
No, but I do have a larger question about fluoride and how that's handled.
So, thank you. Fluoride, this article pertains to adding chemicals within a building, so this article wouldn't cover fluoride. Fluoride's added upstate in the water supply system.
Thank you.
Of the City Department of
Clarification.
Environmental Protection.
Okay.
Any other questions from the board? Questions? Okay, all right, thank you. So we'll vote on the proposed health code amendments. Can I have a motion to approve for publication and comment the proposed resolution to amend Article 141, Water Supply Safety Standards of the New York City Health Code?
So moved.
Let the record reflect that Gail Nyoweth has motioned first. Can I have a second? Let the record reflect Dr. Galvez has seconded. And now I'll take a vote from each member. Dr. Katz?
Approve.
Dr. Kwan?
Approve.
And Dr. Lindsay?
Approved.
Thank you all. And I also approve. With a unanimous vote, we are in favor of the motion and the motion carries. Thank you. So our next agenda item is the proposed resolution to amend Article 175, Radiation Control of the New York City Health Code. Our presenter, again, is Diane Fung. Back to you.
Thank you. Next slide. So as background for this proposed notice of intention, New York is one of 39 states that has entered an agreement with the U.S. Nuclear Regulatory Commission, or NRC. This grants New York the regulatory authority to license and inspect radioactive materials within our borders. Within New York City, our department is responsible for regulating radioactive materials used in medical and academic settings. Our proposal is to amend Article 175 to conform to the applicable federal regulations codified in Title 10 of the Code of Federal Regulations. Next slide. So Article 175 lists certain provisions of Title 10 of the federal regulations that are explicitly not incorporated by reference. NRC requested a change to that list. To comply with the request, the department is proposing the following. Amend section 175-101B by removing the exclusions to Title 10 of federal regulations, sections 1911, subparts C and D. Once removed, these federal provisions will be incorporated into Article 175 by reference. 1911D allows licensees to meet worker notification requirements by providing document copies for review instead of posting them, and 1911C is currently reserved. The second amendment is for section 175-103C by removing the exclusions for 10 CFR sections 30.36 subparts D through K. Similarly, once removed, these 8 federal provisions will be incorporated into Article 175 by reference. The subsections D through K outline administrative requirements for expired or inactive licenses or for site decommissioning. So this includes decommissioning timeframes, financial assurances, and closeout activities. Next slide. We are asking the board to vote to approve for publication in the city record proposed amendments to.
And Mrs. Fung, any questions from the board on the amendments to Health Code Article 175? Okay, all right, seeing no questions, we'll vote on the proposed Health Code amendments. Could I have a motion to approve for publication and comment the proposed resolution to amend Article 175, radiation control of the New York City Health Code?
Aye.
Second.
Thank you. To note that the record reflect Dr. Lindsay motioned first and Gail Nyewith seconded. I'll now take a vote from each member. Dr. Galvez?
Approved.
Dr. Katz?
Yes.
Dr. Kwan?
Approved.
And I also approve. With a unanimous vote in favor of the motion carries. Thank you again, Ms. Fung. Okay, and now we have our last agenda item. Proposed resolution to amend multiple articles of the New York City Health Code in relation to modification of such articles and/or sections. Our presenter is Jean-Baptiste Rudis-Skira, Executive Director of Environmental Health Legal within the Bureau of Environmental Surveillance and Policy. I'll pass it to you, JB.
Hi, good morning, everyone. I'm here to propose the changes to modification provisions in the Health Code. First, what do we mean by modification provisions? The department has authority to modify the application of certain provisions of the Health Code in a specific instance in response to a request due to practical difficulties complying with a particular requirement. There are almost 20 modification provisions in the Health Code. Currently, modification provisions have different language, likely due to inconsistent drafting over time. Some require a showing of practical difficulties or undue or unusual or unreasonable hardships. Others just require unusual but not unreasonable hardships. Additionally, some modification provisions expressly require the health commissioner to make determinations rather than allow a designee. And a small portion of the modification provisions allow the requester to appeal a denial to the Board of Health, which is not required by law or necessary. Modification requests can be granted in a specific instance if the purpose of the Health Code provisions can be satisfied. Here's an example of modification requests made to the Bureau of Child Care a couple years ago. Health Code 4739A requires that a child care space be reserved for a child's exclusive use, not to be shared with other children or adults while the program is in operation. We received the request from a child care program to allow unused space during operation hours to be used for a Mommy and Me program. That request was approved under certain conditions. So what are we proposing? We're looking to eliminate the inconsistency that has emerged over time. The department proposes to standardize all the modification provisions throughout the Health Code. These amendments will create consistent language regarding the showing a requester must make, permit the health commissioner or designee to make modification determinations in all instances, and make the denial of a request for modifications a final agency determination. Here's an example of the same language we're looking to apply across all the modification provisions in the Health Code. As you can see, the standard to request a modification is a practical difficulty. The commissioner or designee can grant a modification of the request. It's also clear that the requester must comply with the terms of modification, otherwise enforcement may be conducted. And lastly, the denial of the request is deemed a final agency determination. At this time, we're asking the board to vote to approve the publication and city record of the proposed amendments to the modification provisions across the health code.
Thank you, JB. We'll take questions for the board on the amendments to multiple articles of the New York City Health Code in relation to modification of such articles and or sections. Any questions from board members?
A process question. Is this a blanket approval going forward, or is it just for specific amendments to the health code?
So this is specific to the different health code sections that have modification provisions. It's not across the board.
I got it, thank you.
Any other questions?
I just had a question. Some of these modifications you said came to your attention like a couple of years ago, right? So this is a batch of modifications that have been, thank you.
That's right. Folks can write to us and request modification, and we'll respond to them accordingly.
And when an amendment is made like that, does that then, like the daycare example, does that extend to all daycares then?
No, just for that particular instance. So we'll get a request from a program saying, look, we're having an issue with this particular requirement. Can you give us a modification under certain conditions? We'll review it and respond to them just for that particular instance, for that particular program.
Fantastic.
Okay, all right, seeing no other questions, we will vote on the proposed health code amendments. Could I have a motion to approve the proposed resolution to amend multiple articles of the New York City Health Code in relation to modification of such articles and or sections for publication and comment?
Motion made.
Thank you so much. Please note Dr. Kwan has motioned first. Could I have a second?
Second.
Thank you so much. Dr. Galvez has motioned second. And now I'll take a vote from each member. Dr. Katz?
Yes.
Dr. Lindsay?
Approve.
And Gail Nywood?
Yes.
And I also approve. So with a unanimous vote in favor of the motion carries. Thank you again, JB.
Thank you.
Okay. And for clarity of the record, I approve amendments of Articles 11 and 13 of the New York City Health Code.
Great.
Okay. So thank you, everyone, for your service, and our meeting is now adjourned.
Thank you.
Nice to see everybody.
Same here.
You, Mitch.
Keep the faith.